Once again, welcome to all of you for this panel discussion. Dr. Sangeeta Gupta's presentation was extremely vast and very comprehensive, and I think it covered practically everything. But before I just start the panel questions, we'll just run through two very important things, and that is what constitutes rape. And as we all know that, just to reiterate, is section 375 of IPC says a man is said to have committed rape if he penetrates his penis to any extent into the vagina, mouth, urethra, or anus of a woman, or makes her to do so with him or any other person, or inserts to any extent any object or a part of the body not being the penis into the vagina, the urethra, or anus of a woman, or makes her to do so with him or any other person, or manipulates any part of the body of a woman so as to cause penetration into the vagina, urethra, anus, or any part of body of such woman, or makes her to do so with him or any other person in the following circumstances. This is very important to understand, because we as gynecologists should understand exactly the definition of rape. And under the circumstances, this against her will, without her consent, with her consent, when her consent has been obtained by putting her or any person in whom she is interested in fear of death or of hurt, with her consent when the man knows that he is not her husband and that her consent is given because she believes that he is another man to whom she is or believes herself to be lawfully married. With her consent when at the time of giving such a consent, by reason of unsoundness of mind or intoxication or the administration by him personally or through another of any stupefying or unwholesome substance, she is unable to understand the nature and consequences of that to which she gives consent, with or without her consent when she is under 18 years of age. Sexual assault. See, POCSO has divided the sexual abuse of women into two categories, namely penetrative, non-penetrative. And penetrative sexual assault is defined in the same manner as rape in the Indian Penal Code. And non-penetrative is any act with sexual intent, like touching the vagina, penis, anus, or breast of the child, or making the child to do or doing any other act with a sexual intent which involves physical contact without penetration. Having said this, let me start the panel with the first question to Dr. Gaurav Agarwal. Can doctors medically examine a survivor, a victim of sexual violence, without a police requisition? Dr. Gaurav?
Yeah, just a moment.
Actually, right at the outset, I would like to say that this is a very, very extensive topic. And so I just try to pick up those questions which are there uppermost in the mind of all practicing gynecologists.
So yes, the simple answer is yes. Anybody can examine on the request directly of the survivor, and one need not wait for any police request to come officially, or for a NGO or anybody. The victim can the directly request for the examination, and yes, there is no need to refer such a person to a government hospital or any corporate big hospital, which prepares MLCs. As you know, although the law is not written that yes, for a MLC you need to have approval from anywhere. So anybody, just like any MLC case, whether it is accident or a sexual offense, any MBBS doctor can examine such a case and prepare the report, and of course that report would be a material evidence as far as the case is concerned, and very much valid, just like your medical certificate or any prescription in a court of law. So yes, anybody can examine, and there is no need to refer. And in fact, the law mandates that you cannot refuse. So it is not only that whether you can examine or not, but it is a fact that you cannot refuse for examination of such a case, and we ought to go ahead for examination and prepare the report and hand it over to the investigative agency upon request. Dr. Leena.
Thank you very much, Dr. Gaurav. That was very clearly said. And this is something which is, I think every one of us should, know this, that the Section 27 and Rule 5 clearly states that doctors should not insist for a police requisition or a magistrate order before conducting a medical examination, and that the hospital shall conduct the medical examination immediately without any delay. Coming to the next question, is it mandatory to inform police when a survivor or a victim of sexual violence reports to a hospital? Dr. Neelu Gandhi.
Hello, everybody. I would like to thank everyone for giving me a chance and an opportunity to, come across and speak to you all. So definitely, we have to inform any patient of rape victim or a survivor or a sexual abuse patient which is coming to our OPD. We are examining them. We must, inform the police regarding this. Section 19 of POSCO Act as well as section 357C of CRPC mandates a doctor to do so, and in case if we fail to do so, we are liable for a punishment up to a term of 1 year with or without fine. Over here, one more thing I would like to emphasize, that at times the patient might not be reporting or not be a person of rape victim or a sexual abuse person, but you should always be vigilant and look for signs. Now over here I'll tell you a very true incident that happened to me. I am a medical officer at Delhi University. So in my OPD I used to have a girl who always used to present me with vague type of injuries. Sometimes she'll have a big lump over here, sometimes she'll come with a swollen finger, sometimes she'll tell me her leg twisted, her ankle twisted, some bruise here, some bruise there, and usually that girl used to come alone to show me in my OPD. And it's a surprising thing because generally in Delhi University एक बच्चा बीमार होता है तो एक झुंड लेके उसको आता है दिखाने के लिए. So it was very surprising for me. Generally, I don't inquire much, but I definitely inquired from that girl various questions, but she was not comfortable in answering anything. So I made a report of what were my observations, and I sent a mail to the CMO, to the warden of the hostel, to the you can say women safety cell which we have in Delhi University, and the principal of the college. Eventually, it was found that she was a sexually abused victim by her boyfriend, who used to abuse her badly, day in and day out, and that case is going on. So this is what I mean to say. We should be vigilant and we should definitely report such things which are there. Of course, over here, I would like to emphasize that if we have you can say a survivor, we should not delay the treatment. By the time you inform the police is coming, everything is there. By that time, you should immediately at the first instance start the first aid and start treating the patient for whatever injuries they are having, and start collecting the evidences also.
Yes, thank you, Dr. Neelu. I think that was very nicely put across.
Dr. Leena, I would like to say one thing here, that if one thing is there in the concern of child is mandatory reporting. Means whenever you see a child, that something child is not giving any history, parents are not giving any history, but if you are suspecting that this child is undergoing sexual abuse, it is the mandatory duty of the doctor to make MLC of that child and inform CWC, that is the responsibility. So this is called as mandatory reporting.
Yes.
That's a very important point that you have highlighted, Dr. Sangeeta, that it is mandatory to report to the police, especially in cases where, the doctor suspects that there is some, that child of sexual abuse. But the point that was very nicely highlighted by Dr. Neelu also, that the doctors should not delay the treatment of the survivor, which should be done even before reporting to police. Coming to the next question. The question is to Dr. Anita Rajoria. I'll take it in two parts. Is it mandatory for a survivor of sexual violence to go to a government hospital for medical examination? And is it necessary that only a female doctor examines a survivor of sexual violence? Dr. Anita.
Thank you, Dr. Leena. Thanks, organizers, for giving me this opportunity. No, it is not mandatory for survivor to go to a government hospital. If she approaches to a public sector or a private clinic, she should be examined there also. And it is rather mandatory. The guidelines are there that all the public hospitals and private hospitals also should be well equipped, and they should have all the facilities to give services to these survivors regarding their medical legal examination and treatment also.
The second part of the question?
Regarding examination by female doctor, you were asking, no?
Yes,
So,
yes. Is it
yeah,
necessary that only a
yeah.
female doctor examines a survivor of sexual violence?
So, according to CRPC, any registered medical practitioner can examine the survivor. Suppose if there is no female doctor in a remote area, we should not lose time, because we will lose the important evidence if we refer her to some other place. So anybody who is there, but this is essential that the woman or the survivor should have given consent to be examined by the male medical attendant. Only then she has to do it. But if she refuses giving all the this thing, then of course the RMP can ask for some other doctor to come and help her, or maybe refer her. But the survivor has to be explained that the loss of time may be loss of important evidence. Regarding POCSO Act, when a child survivor comes, it is preferable that a girl child is examined by a woman doctor, or if she is not available, by a male doctor in rare situations. But the survivor, should have in attendance some of his close confidant along with that. And the survivor must be examined in presence of a female attendant or a female witness. So this is very, very important.
And this I just wish to highlight, it need not be a gynecologist or a medical officer. It can be an ophthalmologist or anybody. It means
Any RMP,
every doctor must know how to do an examination. And the SOP should be is already now so simple that she has to just read it and keep on collecting the samples.
And one more thing, as Dr. Anita, you mentioned, the survivor has to give consent. The survivor is not giving a consent, that has to be documented by the initial examining doctor.
Consent has to be.
Yeah, that consent has to be documented.
Like somebody had asked in the question that the survivor had refused for examination earlier, but as after thought she came after 2 days. Then we have to mention the same MLC. You can now document again that initially she refused to give consent for examination. Now as she has given consent, we are examining her, and you have to document all your findings.
Thank you very much. And the point,
consent has nothing to do with the reporting to the police.
Yes,
the person can refuse that I don't want you to be examined, but that failure of examination. At the same time, you must explain to her that in case if you don't give a consent for examination, all your evidence will not be collected and it will be against you. That similar way of explanation can be there. But in no way it can be denied, and in any way you have to inform.
Yeah, as Sangeeta ma'am has already highlighted categorically that it has to be mandatory reporting especially in case of POCSO.
and
Dr. Gaurav sir has raised a hand.
Yeah.
Dr. Gaurav has raised a hand.
So the very important aspect came in at the last line. So I'll just highlight it. See, as per CRPC, the presence of a female is must. So that should have come probably earlier. The importance. See, yes, any RMP can do it, but and the female, a lady doctor is not required. Fair enough, but the presence of a female attendant is must. So just to highlight, it is mandatory, and one cannot for a female victim. Just that. Thank you.
Yes, very rightly said, sir. Otherwise, the doctor may himself be, caught unaware and maybe in the trap. Yeah.
Absolutely.
Thank you, sir, for
So the
highlighting.
last line is the most highlighted, that a male doctor can conduct the examination with the consent of the survivor or victim in the presence of a female attendant. Coming to the next question, that is to Dr. Mani. Is treatment to the survivor of sexual violence a must as part of the doctor's role?
Yeah, thank you, Dr. Leena. So moving forward, I think most of the part was covered in Dr. Sangeeta's talk. Now coming here, like as mentioned earlier, the patient may refuse to be examined for collection of evidence, but the treatment still remains an important part of our examination. So yes, we have to offer treatment to the survivor, and also the treatment has to be very comprehensive. And whether it's a government sector or a private sector, it has to be given free of cost. That is one thing as per the law mandates. Secondly, it's not only the treatment which we will be giving for the immediate injuries which are present, the bruises, injuries we have to tackle with the tears and everything. That has to be done as a part of first aid and foremost. And more important, we have to give a preventive treatment as well to this lady, because she may be exposed to infections, like she may be exposed to HIV or hepatitis B or any other sexually transmitted like gonorrhea or syphilis. So we have to take care of that. We have to, apart from providing treatment, we have to give a prophylaxis for these. And for these RTI, STIs, take a blood sample for testing, which has to go to the hospital lab, and not in the, most of the time what our residents do, they pack it up in the kit. So it has to be remembered, it is not to be packed in the kit. These samples are to be sent to the hospital lab, because these samples are part of a treatment protocol. So that has to be there. And we have to give a prophylaxis. And in cases of HIV, particularly, we have to be very careful. If we suspect that this lady is at high risk of, the survivor, high risk of getting HIV infection, then we have to give them prophylaxis. PEP has to be given, and preferably within 72 hours. If she comes after 72 hours, she's brought after 72 hours, it may not be given. That's upon the doctor's opinion. And also, more importantly, as the Honorable High Court, Supreme Court in the 2022 November judgments and the guidelines said, we have to follow up these patients mandatorily for their status of HIV and VDRL RPR status. And along this zero testing, we have to repeat our testing after 3 months, 6 weeks for VDRL, and for HIV 3 months and 6 months. So we don't have to just leave this patient. And more importantly, apart from this, we have to, of course, do a UPT test, pregnancy test, to rule out any pregnancy. Earlier pregnancy may also be there. So not only by this act, so that this pregnancy has to be ruled out immediately, and she's to be counseled for follow-up. We provide emergency contraception to the lady. And also, apart from them, the most important part, as Dr. Sangeeta has also highlighted, the psychological support, the psychosocial support. So ideally, what we have one-stop centers in many of the government hospitals. If we have a one-stop center, we have a counselor. So this lady has to be counseled. Otherwise, each doctor is a counselor. If there's no counselor, we cannot say counselor nahi tha, say counseling nahi kari. We do the counseling part of that and provide her psychological support. And in cases of child survivors, we may need to have multiple sessions for counseling. And even for the adults, we may need multiple sessions of this counseling. And follow-up, as mandated by the law, has to be within after 2 days also, because we get the reports and we may need to modify our treatment. And definitely at 3 and 6 weeks, we have to follow up. So this is about the treatment. It has to be basically a comprehensive treatment, not only just the first aid part of it.
Yes, Mrinalini has rightly said, there were a lot of notices and a lot of emails from women's cell that these unfortunate survivors are not followed up, especially for acquired infections, especially like HIV. So, one of survivor turned HIV positive. So we have to be very, very cautious that these girls are regularly, or boys are regularly followed up to rule out that they have not acquired these infections.
So thank you very much, Dr. Mani. I think that was, a very strong message, which is very clearly given, that we have to provide comprehensive care, which also includes the psychosocial support and a follow-up care. Very, very important. And this has to be free of cost, and non-compliance of such a treatment can enable a penalty to a doctor with 1 year of imprisonment. I think that's very important, and everyone has to provide it, whether they are in the government setup or they are in a private setup. So this is, I think, a very important.
Not only imprisonment, or fine,
or fine,
or both. Yeah,
or both.
That's a legal responsibility actually to provide treatment.
Absolutely. Thank you very much. Coming to the next question, that is to Dr. Sushma Sinha. Are past sexual practices still documented in the examination of a survivor or a victim of sexual violence? Dr. Sushma?
Good evening all, and thanks for the opportunity, and respect in regards to Shreedhar ma'am for taking up this important aspect in such a broad and comprehensive manner. So coming on to my question, actually, we cannot be judgmental, or we cannot just decide on ourselves what to do and what not to do. Like NICFS has come up with a very comprehensive guidelines, and Dr. Mani, Dr. Anita, myself, and judges and police person all were part of the committee who developed these guidelines, and it is to be practiced pan India, so that there is some kind of uniformity, and the accused doesn't go scot free. So actually speaking, we cannot be judgmental, and the past record doesn't have actually much of a meaning. And the Supreme Court has recently come down very heavily, because in the past we used to do the two-finger test, and the elasticity and everything was mentioned, but now it is not a practice unless the PS and PV is required for our clinical examination. Like if we want to ascertain whether she's pregnant or not, or any cervicitis or vaginitis, then PS PV is required for clinical examination. For not previously she might be in a relation on her own and without being forced into, but now she might not be comfortable about the relation, and she was not she had not consented for the act. So the past record doesn't have any meaning, whether she was with the guy, with the accused on her own, or it was forceful act. So the two-finger test or the elasticity of vagina doesn't hold much water in today's time.
In fact, very
And even the NGOs are
categorically
actually
said in examination that no comment should be made on the opening and on the margins and anything of that particular kind, both for the vulva, vaginal, as well as for the anal opening.
But still,
Yes.
most of the time,
And
the
the NGOs are
lawyers ask
also
for the
there.
hymen. So there's still a lot of confusion whether hymen is to be commented upon or not. So I would like to add that we only make a comment if there are current injuries. If you see any
Current
bruises
injuries.
or current tears or bleeding, only then we can comment upon.
Yes, the
Old
local
tears,
examination is to be made not for clinical purposes, or
Yes,
mainly
ma'am.
for injuries,
injuries
depending
only.
upon the history.
Yes. Depending on the history, we'll be doing that and commenting also.
Correct. Thank you very
So
much.
even judges were very categorically stating that, even women who are in flesh trade, they can also lodge a complaint for sexual assault. If it is,
Without
rape can be
consent.
committed with them also. So we
Yes.
should you refrain from commenting upon anything like hymen, shape,
Many
size.
times it is not considered.
Neelu, you want to
Yes.
say something, Neelu?
I just wanted to say that a lady who's sexually active doesn't mean that, that consent is for everyone.
Yes.
She has her own will. She has her own wish. It's her
Yes.
body. It's her, consent whom she wants to have relation with. So that doesn't mean, so we are no one to comment upon her past history about her sexual inclinations or her sexual whatever we are saying. Secondly, the examination should be done in a manner that, we don't comment or try to add any information which is not there, which is
Right.
not needed.
Yes.
That is
Correct.
something we should be careful that, we shouldn't add information that is our opinion. We should not be judgmental.
Yes.
So the point
performer
here is
itself is very comprehensive, and it is very objective. Lots of
So-
objectivity is there.
just a small this thing that
Dr.
see the so I'll talk only law. Okay. So the law does not say that it don't comment upon hymen. Just like all other parts of the anatomy of the external internal genitalia, just go ahead and do whatever is required and comment upon it. But yes, it is our interpretation that is important, that despite the hymen being intact, there is evidence of sexual intercourse, full stop. So it does not, the law never says to avoid any comment upon hymen or not to, so this is as far as law is concerned. Yeah.
Okay.
Dr.
So,
Leena,
yeah. So let's move on. And the question goes back to you, Dr. Gaurav. Is it necessary to do an age estimation in every case?
So yes, it is not necessary now. Earlier, it used to be after a Supreme Court judgment. So only even if the age is not contested for, but it is doubted by the doctor, it is entirely doctor's prerogative to request for a age verification test, because the age itself matters about the punishment that could be granted or the accused is liable for. The lower the age, the more the punishment for the accused. So yes, if there is any doubt regarding what the traffic victim or the survivor of rape, sexual offense is commenting, and what it perceives to be, as per the doctor, one should request for a age verification test. Dr. Leena?
So, I mean, I just wanted a clarification from you, because
Yeah.
what we have been reading is that if there is an authentic documentary proof of age, then we need not conduct this. Age
Absolutely
estimation.
true.
But
Yes.
where there is a doubt, or where we can, and even when we examine, we can only give an age range. We can't exactly pinpoint the real age. So, but it is for a fact that investigating authorities do expect the medical age estimation from the doctors. So, is that something that is, how to go about that if the authorities ask for an age estimation?
Yes, if the authority asks, then we cannot insist that, okay, the document says this thing and the victims is saying this thing, so therefore there is no need. If there is either of the two, where the authority requesting or doubt in the mind of the examiner, the doctor, then we have to go for an age verification test, the whatever is required, no, all the 3 or 4. So it is clear regarding that.
And Dr. Leena, it is prudent that every setup has an age determination board, if possible. Involve your dental surgeon, involve your orthopedician. So it will be better if 2 or 3 people are in that age determination board. But if you do not have that kind of facility, you might refer them also for age determination.
Right. So I think that clearly tells.
अब आधार कार्ड है सब लोगों के, उसमें क्या, उसका क्या रेलेवेंट है?
मैम वही बताया उन्होंने कि अगर डॉक्यूमेंट्री एविडेंस है, then we need not do. But if we are in doubt, then we should subject these survivors for age determination.
Half the time, the Aadhaar card does not have a very accurate age. That is approximate sometimes, because we get a lot of patients. Aadhaar में 18 लिखा होता है, but देखने बिल्कुल ही वो 15 साल के लग रहे होते हैं. So we, or it is 16 and they are 21, 22, because वो random age होती है Aadhaar card में. And court of law doesn't take age on Aadhaar as a, if Dr. Gaurav, if I am correct.
Yes, absolutely. Yes.
Aadhaar
Yes.
age is not a documentary proof of age.
No,
That is
no.
it.
And quantum of punishment,
Full
quantum
living certificate or something more authentic, or a birth certificate.
quantum
Yes,
of
so many
punishment
times
is
we've had
4%.
patients
ma'am,
mentioning that कि ये हमारा ऐसे लिखवाया हुआ है 21 साल,
Yeah.
but मैं हूँ 20 साल की, they mention like that. So I think this,
17.5 साल की लड़की है, तो उसके साथ अगर वो सर्वाइवर है तो उसका क्वांटम ऑफ पनिशमेंट अलग होगा, लेकिन अगर वो 18 प्लस है तो क्वांटम ऑफ पनिशमेंट अलग होगा. So age
And-
determination is very, very important.
So yes,
Dr. Neela, you want to say something?
Yes, madam. Over here, I would like to say that not only the quantum of punishment, in fact, the consent itself becomes, questionable. If
Yes.
there is a
Very true, very true.
relationship done
Yes.
with a female underage of 18, then itself it's a different thing altogether. That if she says, okay, it's done by my consent, and you find out that her age is 15 years, that means it's a rape. It comes under the definition
POCSO
of rape.
Act, yeah.
Same goes with wife. Someone says that she's my wife, but she is of under the age of 18. That comes to rape. So consent itself becomes changed by the age.
yeah, and so thankfully, nature is also on the side of the survivors. See, medico-legally speaking, the age of 21, the age of 18, and the age of 16, although 16 की relevance अब कम हो गई है, but 18 और 21 की relevance अभी भी है. तो thankfully, due to whatever the nature ने ऐसी बनाई है human body कि with lot of accuracy we can narrow down it to less than 18 or more than 18 and less than 21 or more than 21. and where it matters a lot for the quantum of punishment for the accused. So I think the nature is also helping the law and human beings and the survivors in a way, in that sense.
So to just have the thing from all the experts here on the panel is that wherever in doubt, ask for a documentary proof of age. I think that is very, very important. Thank you very much. And moving on to the next question, and that is to Dr. Pratibha Singhal. Is it relevant to document when the medical examination of a survivor or a victim of sexual violence was done?
Good evening, Dr. Sharda ma'am, and to all my dear colleagues. It is extremely relevant to document when the examination was done, which means we should document the interval between the assault and between the examination. Although Dr. Sangeeta has said anytime up to 96 hours, and Dr. Sharda ma'am said it should even be documented and done even after 96 hours. Now, if the delay is there, and if there has been an act of urinating, washing, bathing, douching, or passing stool after the sexual assault, our examination may not be very accurate in documenting the findings. Similarly, the mucosal injuries heal very fast. Therefore, the vaginal injuries or the mucosal injuries will not be well documented if the interval is large. Therefore, it is important that the examination be done as soon as possible if the assault takes place and the victim comes to us. And at the same time, we should also document the time that had elapsed between the incidents and the medical examination. Documentation of medical examination when conducted will also help the doctors in framing a better medical opinion. So this is my say on this question. And of course, if others have other opinions or any more opinions, I would love to know that.
Dr. Neelu, would you be?
Yes, there was a query regarding this now. So it is very, very important to document the date and time when it was examined. Yes.
So there is no doubt about that. Moving on to the next question. The question is to Dr. Suman Bishnoi. Who can be present while the doctor conducts the medical examination of a survivor or victim of sexual violence?
Good evening, Dr. Shardajan ma'am and friends, and thanks for giving me this opportunity. Actually, this topic of discussion today was very important, as most of us, other from those who are not from the government job, this topic may sound new for them. So this was very important to be discussed. So regarding your question, who can be present while the doctor conducts the medical examination? So as per section 27 of POCSO Act, it states that whenever a doctor examines a survivor, somebody, either the parent or someone who the child trusts, should be present at the time of examination. And if there is no one present with the child, the hospital has to make arrangement for someone to be present with the child while he or she is being examined. And if it is a female survivor and the examining doctor is a male, as has been already discussed in this conversation, female attendant is a must to be present if the doctor is a female, if the doctor is a male.
Yes, thank you very much, Dr. Suman.
Leena, I would, I would like to add here one thing. Suppose a child survivor has been brought to us, and most of the time, sometimes happens, most of the time it is incest, or the known person, the perpetrator brings a child. So if as a doctor, we feel that child is uncomfortable with that particular person, then we can always take the child into confidence and appoint another person from the hospital or any other person whom the child feels safe with. So we can always do that also. That can also be done by the hospital.
Yeah, that's why it is written now. The child has to trust that person.
Yes, he has to trust that person.
If it is a case of incest, the child will not.
Yeah.
Yes, I think that is a very important point that you just highlighted, that if the child is uncomfortable with the person who has brought her, she can always request, and we should be in a position to get those feelers and to ensure that a person is around her where she is going to be comfortable with.
And there are often queries whether the policeman or the woman who is accompanying the survivor can stand there. It's not allowed. in court of law. But, it has to be someone else. They cannot pressurize that do collection in front of us. So, Dr. Gaurav, you have to add anything to this? Sometimes
Yes.
they insist that do it right there and
Yeah, sometimes, yes, exactly. I was just about to come in. One, that they should not, their consent should not be taken as
Yes.
a witness. Secondly,
Also.
when the female attendant is not there, then a lady constable should not be taken as a attendant.
yes,
It
right.
goes against the entire, philosophy of the examination process and the philosophy of the investigation process. So they should not be taken as a witness to the consent, a female police officer, neither, and nor for being a attendant to the female survivor.
He
I think
politely
that's
asked
a
to stay
very
away and
rightly
go out,
put.
actually.
Yes, yes. I think that's a very, very, very valid point that has been highlighted, that it cannot be the female constable or anybody, related with that or from the police side who will be the attendant. It has to be someone whom the child is knows and trusts. I think that was an important point in this question.
Even a neutral, third part, another patient could be an attendant, or even
Okay.
a neighbor of any NGO, social worker of the hospital, they could be, but never a police officer. That is the point.
Right. Can it be a nurse of the hospital?
Yes, very
Yes.
much. Yes,
Right.
yes, yes, yes. Yes.
So that would be easy for hospitals to involve. Coming to the next question, and we go back to Dr. Neelu. Is it necessary for the doctor to inform or report to the CWC while dealing with a child survivor or a victim of sexual violence?
See, the Child Welfare Committee, they were constituted under the JJ Act in year 2000, and every every district has child welfare committees. Now, it is definitely on the discretion of the doctor to see a judge that is it fine enough in the interest of the child, it's the health of the child, that the child should be handed over to the parent or child should be handed over to the child welfare committee. As we just now had heard that most of the time the violences or the sexual abuse on the children are done by people who are near and dear to them, who are very well known to them. So many times it seems seen that it's the family, the predator is in the house itself, and the child is not safe to go back there, not even physically, not even mentally they are safe. So in that case, in such cases, the child welfare communities should be informed, but definitely it's not mandatory that you need to inform. If it is up to the discretion, and it is up to the intelligence that how we sense it out, that what's going on.
So I think that's a really important thing that you have highlighted, that as doctors who are examining, we have a very, very important role, that we can decide in the best interest of the child whether if going back home is not safe, we can definitely inform and report it to the child welfare committee. So I think this is a very important point which I think each one of us should know and should be the message that we take home today. Would anybody like to add something to this?
It is prudent that these child survivors are referred to some NGOs like Sakhi and all that. So many NGOs are they are running shelter homes for these kind of girls, and they are even giving them counselors, law assistance, everything is given. So it will be a good idea, and every hospital should have a collaboration with one NGO at least of such kind, so that in emergency or for the need arises, they can contact this thing. And somebody has asked it that a counselor can be a witness. Yes, they can be a witness. Counselor from NGO, because as highlighted by Dr. Gaurav, she's an independent witness. She can be a witness.
Yes. Thank you very much. Next question, and the question goes back to you, Dr. Anita. Can a doctor administer anesthesia to every survivor or a victim of sexual violence so as to enable a medical examination?
So it depends on the clinical condition and requirement of the survivor. If the examination, if the child is very small, is scared, then of course by the consent of parents or guardians, examination may be done under anesthesia if they, if they agree for that, or GA is instituted if the child needs it for treatment of any kind, like she's having tears or some treatment is required, which is which is which is in I mean related to the treatment of that particular survivor. Like she's having deep vaginal tears, you cannot stitch them
Comment on that.
without
Yes.
anesthesia, then you can examine the child under anesthesia in good light and then stitch it accordingly, and treatment can be given to that.
Not only a child, an adult also who has
Even
tears is
adults,
suspecting deep.
yes.
We
And
as
especially
one
in
part of
adults.
the treatment actually.
Anybody.
So
for
sometimes
that
they are
matter.
so scared on initial this thing. Sometimes
Children
they need to
particularly.
sit with the child, counsel the child, and the family also who is there with the child. But sometimes they may dissent. They may say no, we can't do it right now. Then they might be called again on the next day. So, but you have to counsel that. So you may lose the evidence already I have highlighted. But till the child is comfortable, you cannot examine the child.
Yes. So I think this is a very something very it's a very difficult kind of situation that you need anesthesia in certain cases, but even to enable a medical examination as also a treatment, like you mentioned about the deep vaginal tears, which may not be visible, so you cannot comment on them till you are able to examine. But routinely we do not administer anesthesia, but yes, in such situations we would need to give anesthesia to even examine the person who,
and keep minimum people in OT when you are doing these procedures, because
Yes.
you have to maintain the privacy and confidentiality of the survivor.
And
Yes.
with proper consent.
Yes, with proper consent.
Proper consent. I think that was a very the question was very nicely and very comprehensively answered, because this is something like an examination. It suddenly comes to us, we would also be wanting to know these particular points that you have said, that without consent we can't take it, and then you should have the most minimum number of people in the operation theater.
And who will give consent for anesthesia? It is again either the survivor is more than 18 years or parent or guardian. Because
correct.
Yeah.
Yes. Anybody would like to add on something
And
to this?
if nobody is there and an examination is important, then the doctors of that particular hospital can also give a consent on the behalf of the child.
Yes, ma'am. Particularly in cases of people brought by the police who are unknown people.
And
then
who have nobody
definitely
coming with them.
Nobody coming in, and for everything, the board can decide, 2 doctors can give consent.
Can the police officers can give consent?
No, never.
Okay.
Never.
It has to be the hospital doctors.
Hospital doctors.
Hospital doctors or unrelated patient,
life saving,
or
then no consent will be
any lady patient would sympathize with the child, that can be requested for, but never police, please.
Okay.
Never police. Yes.
So that's a big
Dr. Leena,
nice
you
message.
need to wind up, Doctor. Do you, Leena, need
Yes, ma'am. I think we would need a session 2 and a session 3 to finish all our queries.
Let me be very frank with you that the Supreme Court judgment, which has come on 31st of October 2022, has got many other judgments before that. I think one discussion has to be there totally on that particular presentation, on the Supreme Court judgment, which has finally come on the 31st. So, Dr. Gaurav, will you like to take up the next, because Dr. Gaurav has been with us since 2004 on this particular issue with us. Mm-hmm. So I think, will you like to take that along with Sangeeta, the 31st Supreme Court judgment, Doctor, next time?
Gladly, because it is a very comprehensive, law, I would say. So yes, gladly, I would. Yes,
Perfect.
definitely.
Perfect.
And
Can we
Gaurav
just
sir,
run to the
another
next
thing is
question,
that
please?
doctors are too scared to appear in courts. So one session will request you to do on deposition in court also.
Yes.
So that is very,
Another thing I just want to know is that, somebody should be brave enough, in fact, or we should call Dr. Kiran Agarwal. In POCSO Act, 90% of the gynecologists are not cooperative, and they are, spoiling the whole thing. एज बढ़ा रही हैं, कुछ कर रही है, ना एग्जामिनेशन का पता है, कुछ है. I think, to subsequently the POCSO Act should be also discussed. I'll ask Kiran Agarwal to do the same. Okay?
Yes, ma'am. I'll just run through the next questions and we'll be very quick. Can a doctor administer HIV prophylaxis to every survivor victim of sexual violence? Dr. Mani?
As I mentioned earlier, we have to weigh whether the survivor needs, depending upon the history, and also within 72 hours. That's a better time to give it. Yeah.
Yes, yes. And follow up of the
follow up, definitely, as I treated earlier also.
Yes. What is the minimum age of a person for giving valid consent for sexual intercourse? Dr. Sushma Sinha?
I think it has already mentioned it is 18 years of age. But
just to reiterate it.
But in our country, it has its own typical problems. Like many a times in OPD, you'll see 15-year-old girl coming pregnant and, for antenatal checkup. We need to be vigilant on that aspect also. And we have to weigh in the risks and weigh in the patient's comfort. I mean, ideally, it should be reported to the police, but even the judges now have not been able
वही बात आ गई gynecologist की. Once they put their mind, they're doing a wrong job.
Yeah, we have to report definitely under POCSO.
We have to report, and even the judges are not very clear because 30% Indian girls are, less than 18, married girls.
Here I will ask Dr. Gaurav, अभी ये जो असम में सारे जो चाइल्ड मैरिज वाले किए गए उसमें आप फाइनली क्या एज बताइए, 15 बताइए कि 18 बताइए?
नहीं, the law is very clear now. 18 year और 18 year से कम हम अगर abortion कर रहे हैं तो it is our duty to report. अगर हम 375 में तो आ ही रहे हैं, but POCSO में भी तो आ गए ना for not reporting, and we are liable for punishment for not reporting.
Correct.
So law is very clear. If we are doing it at our own risk and peril.
Sir, what about married person comes to us as an 18? We are also reporting under POCSO Act, and let the police and then the family take a decision for FIR.
Our duty is complete. If they give in writing to the police that कि ये कुछ नहीं है, घर का मामला है, ये और वो, ठीक है. Because हाँ, मियाँ बीवी राजी तो क्या करेगा डॉक्टर, ठीक है. But डॉक्टर की जो रिपोर्ट ड्यूटी बनती है, see the idea is, see I have 2 clients, both doctors, both not gynecologists, and both had patients जिनके they are facing the music because they did not report minor girls for sexual offense, और दोनों में केस रजिस्टर हो गया है, ठीक है. नाउ आई डोंट हैव वेरी गुड डिफेंस, ठीक है, बहुत सारी सर्कमस्टेंसेस होती हैं उनकी वजह से, ठीक है. बट उन 2 केस, दोनों गायनेकोलॉजिस्ट, दोनों का नर्सिंग होम है, काफी सिमिलैरिटी केसेस में, बट दोनों जो डॉक्टर्स हैं वो पूरी लाइफ के लिए अब स्ट्रेस में रहते हैं कि यार अब या तो इस तरह के केस लेने नहीं है रिपोर्ट, तो वी टेक इट वेरी लाइटली कि यार कोई बात नहीं, क्या जाता है. बट जो लॉ मैंडेट करती है, जो हम पे रिस्पॉन्सिबिलिटी डाली है, सी इट इज सेफर टू रिपोर्ट देन फेस द म्यूजिक फॉर नॉट रिपोर्टिंग. दैट इज द वन लाइन, take home message that should be for all of us.
So what message is clear?
Yeah, what about marital rape, sir? Sir, please clarify between 15 to 18 years. What is the current...
Ma'am, it is a very, walking the tightrope, walking a knife's edge. Even Supreme Courts have, cautioned and not to walk on that on that level, yes, not to touch it. It is a very, very highly debatable thing. नहीं तो घर की कहानी बन जाएगी for that matter, So it is not to be touched in this country.
असम में भी जो वो जेल में गए थे उनको बेल में वापस कराए. अब फाइनल डिसीजन क्या है ये नहीं मालूम.
In this country, we cannot talk about marital rape. We can talk about England. We can talk about UK or any other. I mean, Americas. We cannot talk in India about marital rape. It is a very, very delicate and बहुत सारी issues हैं. We cannot talk about this in this country.
और हम लोग को माउथ ही नहीं खोलना चाहिए डॉक्टर साहब.
We always report
what we
anyone
conclude
married
is
or
then
unmarried coming
if
to
a
us.
lady comes to us married,
Yeah.
married, pregnant in our OPDs less than 18, we should report.
Yeah, we do report.
Yes.
Yes.
That we
Yes.
should do report
That is
mandatory,
Yes.
and then it
Absolutely.
depends upon the court of law and the police and the party what they
What they
decide.
want to do.
As a
Yes,
doctors, we
that's the
have to
take-home message.
report as our legal
Yes,
duty.
yes, that is the take
What is the
Absolutely.
take home for us then?
In
For
a
less than
busy
18,
government-
married, pregnant lady. Yeah.
in a busy government hospital, many a times, the registration counter, they're not sensitized. The residents are many a times
Yes.
not sensitized. 16-year-old, 17, you are knowing, but your residents might not be, very aware about these things. So, like
Yes.
17, one fine morning, you'll see a slip, OPD slip, in which a pregnant girl is, 17 years old and she's been
डॉक्टर
examined.
सुषमा
वो
सिन्हा,
भी- can
इसका
we-
यही तो मतलब है, अगले 2 सालों में आपने यही पढ़ाना है.
And now more
Yes.
importance of CBME curriculum now since 2019 onwards. ठीक है, आज के रेजिडेंट्स को नहीं पता है, बट आज के MBBS डॉक्टर्स को पता है, क्योंकि उनको ये चीज पढ़ाई जा रही है सिंस 2019. उससे पहले जो पास आउट किए हैं उनको नहीं पता है. ठीक बात है. So they are more educated now.
The need of the hour to incorporate medical legal aspects in MBBS and postgraduate as well, because it is really difficult for me to guide all new residents about the same thing. So they need to be told and be guided in a very comprehensive manner, because examination in itself, it takes at least 3 hours. And they are not so patient because MNC is so comprehensive now. It will take at least 2 to 3 hours unless they are, told about in MBBS days or postgraduate days. They are not very much sensitized when they join your hospital.
So we are actually running short of time. So can I just run through the next
Yes,
questions, please? What is the minimum age of survivor or victim of sexual violence for giving valid consent for medical examination? Dr. Pratibha?
Yeah, according to section 89 and 90 of IPC, 12 years and above is the valid age for giving consent. However, in below 12 years age, the parents have to give a consent. But ma'am, I feel that even a girl of 12 years or 13 years, the consent should be taken in presence of parents. She may not be much oriented as to what she has to go through and what will be the medical legal implication of that. That is my opinion. Of course, Dr. Gaurav will be better person to tell us.
Your feeling is very well placed, ma'am. And legally speaking, yes, between 12 to 18, the consent of the minor has to be supported with the witness of the parents. So plain and simple examination, which does not involve any invasive procedure, okay, child can give between 12 to 18, but it is always advisable to seek consent of either of the parents. Yes.
So many a times we get cases when in the 15 to 18 age group, the mother brings a child for examination and the girl says, I went with my boyfriend, I don't want to be examined.
Yeah.
Then in that case, her consent would be given the upper hand rather than the parents' consent for examination. It's a dilemma we face then. The girl says, no, I don't want to be examined. And mothers insist, can you examine karo?
In such cases, what do we do? Even I have had a problem like that. A 15 years old girl was brought by mother saying that I feel she has a boyfriend. She said, it is none of your business, mummy. You mind your own business and I will not get any examination.
That is a common problem in government hospitals.
Even in private, we are facing it now.
So I just answered this in the group. Somebody posted a similar question. So as far as law is concerned, yes, she is right in not allowing the consent and we have to respect her. We cannot force it upon her. But yes, the law also says, mind you, I'm using the words law. The law says that we must counsel the patient, the survivor, and we must convince her to give consent and tell her the benefits of the same. ऐसा नहीं है कि ठीक है उसने कह दिया ठीक है, तो हमें एक लाइन जब उसने रिफ्यूजल टू कंसेंट कर दिया तो रिफ्यूजल टू कंसेंट उसको बोलना है कि ठीक है साइन कर दो, हम आपको एग्जामिन नहीं करेंगे. ठीक है, अगर रिफ्यूज करती है कोई बात नहीं, उसके पेरेंट का करा लिया कि उसने रिफ्यूज कर दिया. दोनों रिफ्यूज करते हैं कोई बात नहीं, आप 2 या 3 डॉक्टर कर दीजिए कि उसने रिफ्यूज कर दिया. बट रिफ्यूजल टू कंसेंट साइन कराना है. और एट द सेम टाइम हमने एक लाइन और भी लिखनी है नीचे, दैट we try to convince and tell the survivor of the benefits and the nuksan or the harm of not getting examined, and put your signature thereon. Our duty is finished.
So that
Yeah,
is
in
informed
last
negative
witness,
consent. We take an informed negative consent, basically.
in the last court attendance of our SR, he asked, the lawyer asked, defense lawyer, कि आपको क्या पता था, लड़की से पूछा गया होगा कि क्या आपको पता था कि ये जांच क्या होती है, और आपने मना किया. तो लड़की ने कहा मुझे नहीं पता था कि ये जांच क्या होती है. मतलब पेशेंट कैन have these false accusations on doctor that I wasn't explained. So very well highlighted by Gaurav sir that you should write that we have explained to her everything in her own language. Still she has
डॉक्टर साहब कंसेंट में बहुत बढ़िया डिटेल में लिखा कि कंसेंट में ये बताना बहुत जरूरी है कि आपका मेडिकल एग्जामिनेशन में हम क्या क्या करेंगे. बिल्कुल बहुत क्लियरली हमें बताना पड़ता है.
मैडम उसी के नीचे नेगेटिव ले लेते हैं उन सब बता के कि मुझे नहीं करवाना, मुझे सब बता दिया ऊपर की बातें. We take on the same consent informed, we take an informed negative consent then.
So
And plus
informed
the sign of the
refusal.
witness.
Informed
mother
refusal
or
for examination, medical examination.
And informed disadvantages also of not getting it done.
Yeah.
कि आपका केस अगर आप करते हो तो लॉ में वीक हो जाएगा, जुडिशरी में वीक हो जाएगा, या आप केस ही नहीं कर पाओगे. एविडेंस कलेक्शन करने के क्या
evidence will be lost. Evidence will
Yes.
be lost. Yeah.
Coming to the next question, is it mandatory to seek an informed consent and for what purpose? Dr. Suman? Dr. Prish.
कंसेंट पे काफी बातें अभी हो गई हैं, बट लेट मी जस्ट कंसोलिडेट इट. Just like other consents, this consent is also to be informed. And informed consent किस लिए करवा रहे हैं हम? For medical examination of treatment, for medical legal examination, for sample collection, and for forensic examination. And this we have to tell the girl that this information is to be sent to the police. And in informed consent में वही हो गया 12 years से ऊपर है तो हम ले सकते हैं, अदरवाइज पेरेंट्स का लेंगे. और डॉक्टर को उसको ये भी बताना पड़ेगा कि हम क्यों ले रहे हैं और मतलब नेचर क्या है कंसेंट का, एग्जामिनेशन का, और पर्पस क्या है एग्जामिनेशन का. उसको ये बता देंगे कि द एग्जामिनेशन विल हेल्प इन द प्रोसिक्यूशन ऑफ दोज हु कमिटेड द क्राइम. सो थोड़ा वो आराम से दे देगी कंसेंट. And the procedure may involve the examination of different parts of the body like mouth, breast, vagina, anus, and rectum. And it may also involve the removing of clothes and taking of samples such as scalp hair, genital swabs, nail clippings, etc. And definitely they have the right to refuse also. But the negative consent, that is the consent to refuse, is also to be taken, and it has to be signed by a witness. And this information, whether the consent is given or not given, whether the consent is given or not given, or refusal, this in any case, this has to be informed to the police.
और ये भी बताना है उसको कि अगर आप नेगेटिव कंसेंट दे रहे हो कि आप पुलिस केस नहीं करना चाहते या ये मेडिकल लीगल एग्जामिनेशन नहीं करना चाहते, तो इससे आपकी ट्रीटमेंट पर कोई इफेक्ट नहीं पड़ेगा, क्योंकि आपको जो आपकी जो
this will not, there is no precondition for your treatment. Yes. So that I think eventually gives the the survivor the confidence in what we are trying, and eventually they do end up giving us the consent. Coming to the next question, in case of an emergency life-saving procedure which has to be performed by a doctor on a survivor or victim of sexual violence, who will consent and how can consent be obtained? Dr. Neelu?
See, in cases of when we are doing life-saving procedures, actually, if you ask me, no consent, and legally no consent of the patient or an attendant or anyone is needed. The doctor itself can give a consent, a panel of doctors can give a consent and do the life-saving procedure any and every time. Because the word itself speaks that it's a life-saving procedure. We are doing it in an emergency. Definitely a surgeon will be there, an anesthetist will be there. A life-saving procedure cannot be done without anesthesia. It will be there. So 2 people's consent is more than enough. If you are doing it in a good faith to save a patient's life, I think no other consent is needed if no one is there possible.
Correct. So we have to, there's to be no delay and we should conduct the emergency.
Gaurav has raised his hand.
Yes, Dr. Gaurav?
So just to supplement Dr. Neelu ma'am's answer, see, it's more than life saving. It is the importance of consciousness or not. If the patient is unconscious, then yes, even doctor's consent is not required, and just go ahead and save the precious life. So, if the patient is conscious, even if it is life saving, then yes, try and obtain the consent of the patient. Thank you.
Correct. Dr. Anita, is it necessary to obtain a court order, or can police give consent for the medical examination of a survivor or a victim of sexual violence who does not consent?
So we have discussed it at large earlier also,
Yes.
that the police people should not be involved in giving consent because they are from the side of prosecution. So it has to be an independent other witness.
Correct.
And we can no court or no police can force a survivor to have medical legal examination.
Yes. Dr. Mani, are the injuries present in all cases of sexual violence?
No, not necessarily. As was discussed in Dr. Sangeeta's presentation very beautifully, that to say that a lady suffered sexual violence, injuries may not be present, because as we all know, it can be, the lady may be unconscious under drugs or any psychotropic drugs or anything. She may be, like, date rape is such a common thing which we all face with when they come to us, or under duress, harm to her or her family members. I have a gun pointing here, so who would? And or a lubrication was used or any other, so it is not necessary. So accordingly we have to mention in our opinion, right? So accordingly we can mention. So it's not important that violence is present, any evidence of sexual violence is present.
I think this is an important point, and it has been seen that injuries are present only in 33% cases of sexual violence. That was quite an eye-opener. Thank you very much. The next question, is it necessary to collect all the medical evidence in all cases of sexual violence, even when there is a delayed reporting after the alleged sexual violence? Dr. Sushma, this
the history is very important. It guides us towards from where the sample needs to be collected. So if she has got like anal intercourse or vaginal intercourse or any breast fondling or oral sex, so the sample needs to be collected from that area only, and the rest of the envelopes has to be marked as sample not collected, because suppose she has had oral sex, the vaginal samples, and she doesn't give any history of vaginal sex, so the samples need not be collected from there. Only concerned area. What was the second part of your question?
When there is a delay in reporting after the alleged sexual
Dr. Sharda Jain ma'am also very nicely highlighted that even after delayed sexual violence, the spermatozoa, the dead spermatozoa, is still there in the posterior fornix or near cervix up to 3 weeks. So at least for a month or so, the medical legal examination needs to be done. And like if it is like 1 year old or 2 years old, then you don't expect to collect any sample then, because she has changed her clothes obviously, and all the sample evidence is lost after so many days. But till 3 weeks, of course, one should be careful enough to collect the samples. If she has got vaginal intercourse, the spermatozoa will be there in the posterior fornix near the cervix.
There is an inquiry which is going on in one of the hospitals. I will not take names. They were questioned that the survivor had reported after 24 days that why didn't you collect the sample?
No,
so luckily
it is reported that 21 days for dead spermatozoa, even up to 42 days, literature says. So it is very a blurred kind of dateline. So of course, for such a narrow gap,
everything is on a DNA testing. In case if you be examining it, then taking the swabs from the vagina or the cervix probably will be good, because जो भी कुछ है, अगर उनको DNA material मिलता है तो बहुत अच्छी बात है, नहीं मिलता तो बहुत अच्छी बात है.
So I would like to ask Gaurav sir, like we had a lady coming recently after 2 months, and she was insisting कि मुझे sample दिलवाना है, आप kit खोलो. So we took a consent कि although we will find nothing, but since she was insisting, just to put her mentally at ease, we did open waste a kit. In fact, we just opened a kit, and according to her past history, And it was so difficult telling her कि we will get no evidence, nothing. But she kept on insisting कि मुझे तो करवाना है, मुझे आप लोग कर नहीं रहे हो. So to be honest,
Money, I think you were wrong. आपका काम है जब उसने बोल रही है तो आपको कलेक्ट करके भेजना चुपचाप.
Yes.
See, कल को अगर
हमने भेजा, हमने फिर साइन लिए, हमने भेजा. And we also mentioned कि that we have explained that Rumi, but since you're insisting, हमने लिया और हमने भेजा उसको. We did make an MLC and took the all collection, used the safe kit and filled all the forms, and we did send also. वो हमने भेजा मैम.
क्योंकि अगर हम नहीं करते कल को वो अपनी स्टोरी चेंज कर देती कि भी मैंने तो कहा था कि ठीक है 2 महीने पहले हुआ था बट बीच में भी हुआ था तो उसकी स्टोरी चेंज करने में तो हमें तो अपनी रिस्पॉन्सिबिलिटी जब वो कैटेगोरिकली बोल रही है तब तो हमने अपनी ड्यूटी फॉलो करनी ही है डिस्पाइट फुली नोइंग दैट इट इज नॉट गोइंग टू सर्व द पर्पस ऑफ एग्जामिनेशन. यस,
वो ये भी कह सकती है कि मैंने डॉक्टर साहब को बोला था, मैं तो भूल गई थी कि कितने दिन हुए थे. It had just
वो तो 1 हफ्ता पहले भी हुआ था. So we said to be legally safe, कह रही है तो कलेक्ट करो और भेज दो.
अब सबसे बड़ा एग्जाम्पल है डाउरी डेथ केसेस. उनमें जो कंप्लेनेंट होते हैं, जो विक्टिम के या डेड पर्सन के जो रिलेटिव्स होते हैं, दे चेंज देयर स्टोरीज एवरी मंथ. और उसमें अगर डॉक्टर ने अपना काम पूरा ठीक किया है तो वो बच जाता है. अगर वो स्टोरी के चक्कर में आ गया तो फिर तो बस वो भुगतता रहेगा पूरी जिंदगी. So we must do whatever is required from our end.
Should a doctor do a medical examination, collect evidence if the woman is menstruating? Dr. Pratibha?
Now, during menstruation, it is little difficult to make the examination and document the findings because the menstrual blood inside the vagina will be obscuring the findings. But in spite of that, the internal finding may not be documented, but the external findings will be well documented and they should be examined completely. So therefore, it is wrong to delay the medical examination because due to victim menstruating. It would be most appropriate to make the complete examination of whatever is available, whatever is possible, and also to commence the treatment of prophylactic HIV and to send the samples for all other sexually transmitted diseases.
And don't forget to call the patient after menses is over.
Yes,
Yeah,
yes.
that's right. Yeah, that's right.
Yes.
That's right. You are right. Yeah.
What is the relevance of special tests and investigations during the medical examination of a survivor or a victim of sexual violence? Dr. Suman Bishnoi, because this is something we all
there are some special tests and investigations like examination of minor injuries with a colposcope or finding the presence of semen by Wood's lamp examination. But the research evidence is divided on the use of these special tests. So they should be done with caution in case of sexual violence.
Right. What should the doctor or a hospital do in case there is a delay on the part of the police in collecting the sealed evidentiary materials or packets? Dr. Gaurav?
So this is a common situation that we face. And और पेरीफ्री में यूपी में बोले या आउटसाइड मेट्रोज ये बहुत कॉमन है. द पुलिस डज नॉट कम एंड कलेक्ट द एविडेंस. सो आवर ड्यूटी इज टू रिपोर्ट टू देम either by a 100 number call or by registered post letter or by telegram. तो अब नहीं है, by by any other means that is possible, so that they come. And even if they do not come, then it is our duty to inform the DCP of the area. So कई बार ऐसे होता है कि बहुत सारा एविडेंस होता है तो फिर वो एक साथ इकट्ठा करके ले जाते हैं. And in many medical colleges that I worked in the past, it is a monthly routine that a letter goes from the Department of Forensic Medicine to the DCP to collect whatever evidence has not been collected in the past 1 month of all the cases. So this is our duty and we must inform the police accordingly.
Another question for you, is the doctor an expert witness?
Yes, doctor is very much an expert witness as per Indian Penal Code, Indian Evidence Act rather, and under section 45, even it is commonly believed that it only applies to the when a doctor is working in the government sector. But in the private sector, as a expert witness, I have participated under and given many reports which have been considered by the court under section 45 of Indian Evidence Act. So yes, every prescription that we prepare, every medical certificate, every document that goes under our handwriting is a legal document, and it is its value is same in a court of law as we were working in the capacity of a government doctor.
The
Whether rape has
deposition,
occurred or
whether
not,
हाँ,
yes,
rape occurred
yeah,
or
we
not.
should not comment upon it, and we should see. हम basically दो ही opinion देते हैं, whether there is evidence to suggest recent sexual intercourse activity or not. Secondly, whether the victim is habituated of sexual intercourse or not. और प्रैक्टिकली इन दोनों से अलावा ऑफ कोर्स इंजरीज होंगी तो उसके अलावा तो वो तो मेंशन करेंगे ही, बट एज फार एज सेक्सुअल इंटरकोर्स इज देयर और नॉट, तो ये दो ही ओपिनियन हमें मैक्सिमम 99% यही दिए हैं, और इट सफाइसेस द पर्पस ऑफ द कोर्ट. अगर नहीं है एविडेंस तो देयर इज नो एविडेंस टू सजेस्ट एनी एक्टिविटी ऑफ रिसेंट और पास्ट सेक्सुअल इंटरकोर्स.
But nowadays they say that
habituated word use करना चाहिए,
intercourse
नहीं
should
करना
not be
चाहिए.
taken into account.
Yeah.
No, it is only when asked by the police to that effect. और अगर
But we are
evidence
not
बहुत
supposed
clear
to
है,
answer.
sorry,
But we are not supposed to answer.
see, अगर repeated sexual intercourse का है तो yes, habituated word can be replaced by repeated sexual intercourse.
But
That is even safer.
whenever there is a condition of sexual assault, we are talking about that single incident.
Yeah.
Yes,
We are
sir.
not supposed to go in the past that what
Previous
that.
activity should not.
So I think as far
No,
as
not routinely. If it is very obvious from the examination,
But
then
even
we
we are
must
not
report it.
supposed
This could, if a
Because
girl is
इसकी
unmarried,
value
to
क्या
go
है? Let me
against,
explain.
वो they
इसकी
will
value
raise
ये
a
है
challenge.
कि अगर recent का evidence नहीं भी है, but past उसकी
No, I think we
examination
should not
बता रहा
answer
है
about that.
कि she is undergone repeated sexual intercourse. Therefore, there might not be any evidence of recent sexual intercourse.
No,
But that
no,
does
But
not mean that there
has
is
to be
rape
with
or
the
not.
same
That is the
person.
point.
That
No, but
repeated
we are not
activity has to
supposed
be
to
with the
answer
same
that
person.
question.
Yeah.
No, I am saying, see, my point here is if a survivor has had repeated sexual intercourse, which is evident from the examination, but there is no evidence of recent sexual intercourse, this goes to show that she might have had history of repeated sexual intercourse, but that does not mean that no evidence of recent sexual intercourse does not go in favor of rape. Rape could still be there. That is my point.
But what I feel, I'll go through again the literature. They have said that you are not supposed to comment on past
previous sexual history.
previous
Yeah.
sexual history.
Yeah.
Very
But
No.
we just comment upon whether the evidence of any sexual injury is present or not,
Correct.
or any physical assault is present or not. And upon that, we base our provisional depending on the permutation
But
combination.
you cannot say
That's
whether
so-
about
If
the
both
past.
are absent, we cannot say till we have
No,
the
we-
report
we,
from the CFL of the DNA. So final
When
opinion
we
can be
say
only
we'll
made
have to
by
see the literature, I'm talking about as, see, it benefits the survivor.
Hi.
That okay,
If we
पास तो था ठीक है, but recent नहीं है, but उसका recent का कोई भी और evidence
I
होगा
would say कि
that we are
उसका
supposed to
past
highlight.
history- Past history is not to be taken as evidence. You can take any other instance. Drug
I'm not talking about history. I'm talking about examination part. If it is evident in the examination, then we ought to note it over there. History, I'm not talking about
It's a
history.
judgmental thing, and it can be said that yes, that can be a slur on a personality actually. If we
Yes,
say
yes.
that she is
Yes,
habitually
you cannot say.
habituated to sex and she had multiple partners earlier also, particularly if she's unmarried. So that would be, I think we have
For
to.
married
no.
and married,
No, it
widow,
is not that.
anything, we should not
See,
comment
my
on the
point-
past activity.
Yes, ma'am.
No.
Either whether married or unmarried, I don't think so. Like old tears
No.
present or not.
Now, my point
I
here
would,
is that when we are commenting upon the examination findings that suggest sexual activity in the past, that means that the chance of finding evidence of recent sexual intercourse would be very minimal. That is the point.
So what I gather you're trying to say there'll be no injury if there's no sexual injury to local parts,
Yes.
maybe because
Yes, that is what I'm
she
saying.
is
Or evidence of recent sexual intercourse might not be there at all.
Injury
That
is
is the
hardly
point.
there.
But they never
Yes.
say to
That
write
is
this
the
line.
thing. We have to write that there is no evidence of recent
Injury.
Yes, yes, that
Why
But
comment
we are not
the,
supposed to
it's
comment on
like
the
the
past.
two-finger test again. We are revisiting the
Again,
two-finger
yes,
test.
yes.
So because how can we say that
So
this is
see,
the
आपको
criteria
पढ़ने
of
की
the
बात
post?
है, very categorically in various judgment it has been written down.
That-
And even in this examination by the bulletin which is in 2019.
Right. So I
if I
think
may-
the deposition was very interesting, and our all our esteemed panelists has a lot to say. I think we should continue with the deposition in the course of other questions.
I
in
think
the
we can
subsequent
carry it on
forum
in
because
some next date.
yes, yes, we
Correct.
should carry on this because
Now,
I
so
think
I have to ask you 2-3 questions. Now
Yes.
I can see the very senior faculty member who has been part of this particular program and who have to take it forward. Now I had talked with the Director General of Family Planning, and she said she will get it one organized right in the in your DGHS itself. That everybody, all the down there and get things done. Now, how are you going to percolate things in?